Sometimes people ask me this question, why do I teach medicine and the Holocaust? You're not even Jewish. And I think that's an interesting question. What stake do I have in this subject? And I think it's an important question because, after all, most of the world is not Jewish. But I think the questions that medicine and the Holocaust raise for our profession as a whole and our society as a whole are universal questions that go beyond one particular race or religion. I think the idea behind teaching medicine and the Holocaust is important because it allows us to focus on the sacrifice and suffering of the Jewish people that both lived through it and died during the Holocaust as a form of remembrance. I think remembrance and understanding the deeper meaning behind that is absolutely vital, and that's why I teach about medicine and the Holocaust. When we use that word and we think about that word, it rightly points us back. We should think about remembrance as a way of honoring those people that have gone before us, and certainly in the Holocaust, the people that suffered at the hands of the medical profession. We should never forget what the medical profession did through its hubris, through its abuse of power. And it's a way of restoring the recognition of the dignity that those persons should have been given in the time. Physicians can learn from their mistakes as much as from their progress. So I do think that that's an important element. Whenever we talk about remembrance, we should be thinking about the restoration of the dignity of the human person that suffered during that time. But I also like to think of remembrance as a way of looking to the future. Remembrance, to me, points backwards, but it also points forwards. It tells us about the mistakes that we made, but also about where we can change those mistakes to point medicine in a different direction going forward. And that's crucial. I think that's crucial to my students, and that's one of the things they really appreciate about studying medicine and the Holocaust, is it can light the way towards seeing what medicine ought to be and where we should focus our energies. And really, in my view, that ends up being the dignity of the human person. Your patient always comes first.